Hi, I'm Kelsey, and I work in CCU at St. Vincent Infirmary on the night shift. I am also the representative for CCU for Congress, as well as the Congress Secretary. Happy New Year, everyone. I will be going over the Congress review from our meeting from January 3rd. In our meeting, I went over the relationship-based care. The Safety First recipients were Jean Hartman from St. Vincent Morrilton, Sarah Ostrom from Hot Springs, and Christina Pininato from St. Vincent Infirmary. The Joint Commission survey update was done by Cassandra Fonesca, and the Standards of Nursing Practice was also done by her. The RN Quality Performance Incentive for FY17 was done by Joanne Frazier. Quality is everyone's responsibility, please remember that, and bonuses will be delivered on the January 20th checks. The Unit Council agenda topics updates were discussed, and we know there's a lack of linen. And if there's a lack of, please email Teresa Lambert at tlambert@stvincenthealth.com. Supplies, we know there's a lack of. So if you see there's a lack of supplies on your unit, please discuss that with your manager, as well as email or speak to James Davidson regarding the PAR levels. NEOC recognizes this is an issue, and they're trying to come up with action plans for this. We will continue to address this issue. The Nursing Research Council went over that the Nursing Journal Club will next meet on Thursday, January 12th in the DePaul room. Literature search and review. If you're interested, please contact Amy Funderburg. Safety Quality Council, good news. Blood culture contamination rates have decreased, so please keep doing a great job. The BCMA scanning with patient armbands is very important, so please make sure that you're scanning your patient's armbands before giving any medications. This is an issue, and please fill out an iris. Only about 5 units at CHI St. Vincent Infirmary are hitting 90% or higher on scanning. This needs to be addressed, so please scan your armbands. Make sure to include the BCMA barcode, patient information, medication label, and attach the error message to the form and fax it to pharmacy on the IRIS report. Nurse-driven protocols are also being implemented 20% of the time. Need to make sure they are being implemented on your unit. New fall mats are to arrive to all units. Let your nurse manager know if you do not have the proper supplies and fall prevention supplies that you need to make sure your patients are safe. The Patient Throughput Council discussed that the patient flow supervisor position is available. There's transporter jobs available, patient access center, as well as case management also have positions available. So refer your friends. There's also a sign-on bonus. Clinical Informatics and Advisory Council. They went over that there are some projects on track, which is great. Documentation of restraints, plan of care, and others will be looked at by IT. So please make sure you're documenting. Patient Education Council is working on a patient pamphlet, so that's more to come on this. The Staff Education Council is working on a PCT CBO tool, so more on that. RN Recruitment Retention Council. They request to do a pilot study to lengthen hours for the cafeteria to make sure that it's more hospital friendly, more night friendly, and there's a suggestion of possibly surveying all the night shift staff. So night shift, if there's a survey, please fill it out. This is very important, especially if we want to lengthen our cafeteria hours and have more food available for us. RISE project organization ideas. If you have any ideas, please email Katie Stringer. Nursing Roles Relationship-Based Care Council. They request to combine the STAR and Compassionate Care Award nomination forms, as well as they went over the Memorial Meditation Garden and memorial plaques were discussed. They need names, years of service, and unit name that they worked on. Email this information to Cindy Goza. The Resuscitation Advisory Council. They discussed that the critical care patients are holding in the ER and discussed the code blue and code white rates. Discussion of getting a travel monitor for the code white team was also done, and they're also discussing an extra heart monitor possibly being on another unit that maybe they could use as well. Post-Code Blue huddle forms are rarely being filled out. These forms need to be filled out for all Code Blues. This is an issue, and we will develop an action plan for this. This form can be found on the top of in a drawer in the crash cart. So this needs to be done on all patients. This is how we know if there was an issue during the Code Blue, and we can then address it. The Policy Development Review Council. 2 policies were updated, and please read your practice updates for these updated policies. General announcements were done by Amy Funderburk, which consisted of the staffing summit was discussed and different staffing issue strategies. There'll be another staffing summit, and we will welcome staff to attend. Look for more information on this in the dates. January 14th, 2017, the recruitment fair at the Four Seasons in Little Rock. There will be NCAP points available for peer interviewing. Email Amy Funderburk if you're interested in participating in the peer interviewing, so sign up. Please reach out to Teresa from Hot Springs because they will also be having a recruitment fair that same day. The NEOC PCLC review was done, and the unit council agenda topics was discussed, and one of the discussions was about Voceras and how they're not properly working. And I then did the roll. And that was the end of the Congress review. Y'all have a wonderful day.